Listen to this. If you notice your child has the following: the child is always snoring, is always having noisy breathing when he or she is sleeping, is always feeling as if there's catarrh, the nose is always congested, as if the nose is blocked. The child is not always sleeping well, is always turning and turning on the bed. The child is always opening the mouth. Don't just ignore it. Okay? When you see a child doing all these things, what it means is that the nose is locked. There's something in the nose that is blocking the airflow. Because naturally, children breathe with their nose. They don't breathe with their mouth. So if something as tiny as anything blocks the nose, it's going to show. Even something that can make an adult sleep well, that adults can easily get away with. If it happens in a child, it will affect their breathing. It will block their nose. And you see the child breathing with the mouth. You know, the nose is so important when it comes to breathing. It's not just to take in air and drop it in the lung. The nose makes the air that we breathe, cooler. It makes it warmer for the body. Depending on temperature, it adds a little moisture to it so that you'll not just be breathing very dry air. It will move any debris, any particles that may come our way. But when this child is constantly opening the mouth, the child is taking in the dry air, and that is why this kind of children may end up having bad breath, may end up having sore throat as well, and also have, when they wake up in the morning, their mouth looks so dried. So don't assume that because your child is always opening the mouth, possibly he's learning a bad habit, because you may actually think so. You say, this child is so stubborn, he's always opening the mouth, he does not hear word, I'm always trying to force him to close this mouth. It's not. What you need to do is to find out what exactly is making this child to be opening the mouth all the time. Now, here are the possible reasons. Number one, an enlarged adenoid and tonsils. Adenoids are normal tissues. They are normal tissues of the body that are located just behind the nose. Okay? The tonsil on its own, they are located in the mouth. Right? Now, these tissues, which are normal body, they are not just there for fancy. They help the body against infection. They help the body to build immunity. But in children, this tissue can get bigger, especially from age 2, 3 to like 6 years. When they grow bigger, irrespective of what the cause is, they will obstruct the airflow because the adenoid is directly at the back of the nose. So it will now cause a reduction in the airflow. Assuming this is the airflow, and you have something that is as big as this inside, you see, it's going to reduce the flow of air. And that is why you see such a child displaying all those symptoms. Even the tonsil on its own can as well cause obstruction in that part of the mouth where it is, because air flows through that part into the air pipes. Now, if the tonsils are now big, they can as well cause obstruction there and cause snoring, cause noisy breathing. Now, another thing that can make your child to be having all those noisy breathing, congestion, snoring and the rest is if that child has allergy. Because there are so many things in our environment that the child can even react to without us knowing, without you, the parents, even knowing. Starting from even the beddings, the bed sheets, the pillowcase, okay? Even the environment, dust, smoke, from generator, from stove, from firewood, from cigarettes, child can react to it. A child can also react to even flowers that you innocently planted for beauty's sake in your environment. Those flowers, the pollens, the child can react to them. Even down to the pets you are keeping in your room, a child that has allergy can react to the fur, the skin, the hair, of the pet, like dog, cat. Now, when your child is exposed to those things that can make them to react and cause allergy, the nose will start swelling up, secretion will now be produced, mucus secretion, that child can start sneezing. Another thing that can explain why your child is always having noisy breathing is if that child has been having infection in the nose, sinusitis, has been having chronic catarrh, possibly have been having runny nose, discharge, catarrh, sometimes yellow, thick, foul smelling, some are even greenish. There's something I just remembered. Part of the allergens a wet wall, if your wall in your house is wet, producing mold, change all those things that will change the color of the wall, sometimes greenish and brownish, all those mold, those things can make the child to react. Those things can cause allergy also in that child. So what should you do when you notice your child is having all these things? One, watch that your child very carefully, okay? Whenever your child is having that difficulty breathing, having noisy breathing, especially the one at night, if you can make a video, a picture of that, video it, so that whenever you get to your healthcare practitioner, you can, show them, describe it for them. Get a saline nose drop and instill into the nose. You can do steam inhalation for that child, especially the one that has chronic catarrh infection, the one that has allergy, the one that has congestion in the nose. You can do steam inhalation for the child. If you don't know how to do steam inhalation, there's a video I made. I have made several videos on that on this channel. Check it out. You will see how you can do steam inhalation for your child, okay? Then when your child is sleeping, you can raise the head of the bed so that the child's head will be above, a little higher than the body. And then please take your child to see the doctor. If it is as a result of adenoid and tonsil treatment we commenced, sometimes we can use medical treatment. But if it's not what medical treatment can handle, surgical treatment will be given. Just a simple surgery, sometimes a day surgery or overnight you are at home. And if it is due to allergy, you can be given anti-allergic medication. Then you should prevent your child from being exposed to all those allergens. Wash your beddings, wash your curtains. If the house is having mold, you can change the child's room. Or if it's worth relocating from that environment, you can relocate. Make sure the child is not always exposed to smoke. If it's for you to remove even the rug in your house or the pets, the flowers, please remove them and then follow up with all your doctor's recommendation. So don't keep that child, don't ignore, don't blame the child for always opening the mouth. Take that child to the hospital, let the doctor look at it. It may be any of these things I have mentioned, okay? And it can also be anything else. All right, see, these things should be addressed on time, because the dangers of not addressing them is not a good one. If your child is constantly snoring, having noisy breathing, it's going to affect the sleep. And when that sleep is affected, it's going to affect the brain, it's going to affect the academic performance, it's going to affect the growth, it's going to affect the heart. Another reason why these things should be addressed on time is because if left untreated, it can affect the shape of the face. If your child constantly breathes with the mouth, making the mouth look somehow, the teeth more prominent, the jaw becomes smaller, the nose looks funny. What they call adenoid fascia, especially for the children that has enlarged adenoid. Okay, so do well to follow me for more ENT health education, and share this video, like this video if you are yet to. I'll see you in the next one. Bye.